Indiana Physical Therapy today, and I'm joined by Kara Lowenstein, and she is a speech pathologist.
Yep.
So tell me, what does a speech pathologist do?
Well, we do a lot of things, but a speech pathologist, basically we evaluate and then treat diagnoses related to speech, language, cognition, which a lot of people don't think about, and swallowing disorders.
So that, you said swallowing, that makes me think of stroke victims. I remember when my grandpa had a stroke, and that was the one thing that he had issues with. So you do work, it's not just, I guess when I think speech pathologist, I think of kids. You don't just work with kids.
No, kids and adults. Here in the outpatient setting, we probably see about 50-50. Kids more in the summertime because they're not at school, so they use that 3 months break to come and see us and get a boost in their speech. So yeah, no, but it's about 50-50 kids and adults. Well,
yeah, I guess I didn't think about it being at Indiana Physical Therapy, because you know there are speech therapists, there are speech pathologists. Apparently I need some help with my speech, but you don't think about it being a muscle issue, but it really is, isn't it?
Right, yeah, it's definitely a muscle issue. I mean, your larynx is full of muscles, your tongue is one of the strongest muscles in your body. Yeah, oral motor muscle problems are a big thing we work with in speech therapy.
Obviously, there are some situations where you know you need a speech pathologist. Maybe you've had a stroke and you have swallowing issues. But what are, how would I know in an otherwise, not typical situation, or maybe not an obvious situation, how would I know if a speech pathologist could help my problem?
Well, I guess it depends on what sort of problem you're seeing. I mean, if you have a child who has who's maybe 8, 9 and is having trouble with a certain sound, then you think, okay, well maybe my child could benefit from speech therapy. If you're an adult and you all of a sudden are having trouble getting words out, or say your voice starts going, things like that, I mean, those are light bulb moments to say, hey, maybe I should talk to my doctor about this and see if I can get a speech therapy referral.
Well, I guess that was my next question. Then if I am having issues, and a voice thing is something that, I'm a little familiar with. Right. And through all the years of cheerleading, we would have, you lose your voice and it just comes back. Well, as you get older, it's not coming back so easily. How do I get to a speech pathologist?
Well, you do. You go see your doctor, your family physician, and they can write you a prescription for speech therapy. Speech therapy is a little bit different animal than the other therapies because we are what they call direct access. So you don't need a doctor's referral to come see us, but most insurance companies and Medicaid, Medicare, they like to have that doctor's referral. So we always suggest just to go and get the referral.
And if, in the case of a child, if it's my child, if I have any concerns, I could bring the child here and you can tell me whether it's truly a speech issue or maybe it is just a part of growing up.
Right, exactly, yeah. I mean, there's some parents that come and see me and they say, hey, my 4-year-old can't say their S sound. Is that a problem? And then I evaluate and we talk about that and, do a lot of education to, what speech sound should develop when and how language should develop, things like that. And yeah, oftentimes I see parents come in and I evaluate their children. I say, you know what, your kid's great, they're doing fine. So
sometimes it's just because they're 4 and that's
right. Exactly, yeah.
You were talking about cognitive skills or cognitive issues. Can you explain that a little more?
Yeah, a lot of times after a stroke or a traumatic brain injury, there are cognitive deficits with it. So mental thinking skills like problem solving, reasoning, memory is a big one. And those skills are affected. And the reason that speech language pathologists work with that is that those skills all affect your speech and your language skills. If you can't remember what you were going to say, then that's affected. So yeah, we work a lot with cognition.
So if I want to find out if my child might need speech therapy, or maybe I have a parent who's had a stroke and I'm their caretaker, or maybe it's even something for myself. Is it at all Indiana Physical Therapy locations? How do I find out where you are?
No, that's a good question. We're only at the Stellhorn and Laymeyer location. We offer speech here and occupational therapy along with physical therapy, so it's a whole neurological based program here. You can go to our website, it's indianapt.com, and it has the address for this location. you can call us. It's 482-7800 and set up an appointment.
I do want to point out to people too that we're in your room here, and I think that's important because especially if you're working with a child or if it's working on those cognitive skills, we've all been in physical therapy situations and you're in a big open room and there's lots of activity, but this is nice and quiet and able, kids or adults alike could focus in here.
Right, and that's the whole point. I mean, to have a closed-in setting that's private, you know, because we do all one-on-one therapy, so it's all private therapy. The door can be shut. If you need it to be, you can open the door. I mean, some of my dysfluency kids, my kids who stutter, sometimes we need to push them in a social situation, so sometimes we'll take them out. But you know, the times where you need to have privacy, to do your thinking, to not be shy with your articulation, it's great to have a private setting.
Just one more reason you should call Indiana Physical Therapy. If you think that you might need a speech language pathologist, give them a call here at their Stellhorn and Lehmeyer location.